Call to order the Thursday, October 9th meeting of the Criminal Justice Committee. I assume all members have had a chance to read the minutes of the previous meeting. If so, I'll entertain a motion to approve.
Make a motion to approve the minutes of September 4th, 2025.
And I'll support that motion.
Moved and supported. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed, same sign. Motion carries. Finance reports.
You will find your project income statement in your packet, and you will see that you have a cash balance of a little over $92,000. If there's any questions, I will attempt to answer them.
Questions of the finance report? Hearing none, we'll move to the sheriff's report.
Okay, attached is that you also have the sheriff's report. We're pretty happy with our corrections compliance that we found, or MDOC came and did our inspection and found 100% compliance, which we were kind of wondering if that actually exists because we've never been there, but we were able to meet that. And it goes to a big credit to our team that's working down there, as well as county maintenance, helping us get a lot of things accomplished down there. It's really looking great, and the improvements are amazing. We also did get approved for that JAG grant for our corrections programming and that sort of thing. It's a one-time grant, but it does kind of give us a little launch pad to get going. Other than that, we had a couple of retirements. We've had a couple new hirees, and our staffing's starting to look really good. If anybody has any questions?
Very good. Questions of the sheriff's department. Commissioner Van Dorn.
Can you just refresh my memory? I'm looking at the jail admissions in High Count. What is the maximum at the jail? What?
We have 286 as a max.
200?
I believe that's what it is. Yeah, so we're running 100, 105 is about where we're at.
Okay.
Unfortunately, you know, it's a footprint, so it doesn't matter if it's packed or if it's light. You still have the same number of people have to watch that footprint. So we're a little less burdened by the numbers, but we still have inmates everywhere that we have to take care of. And unfortunately, they're usually the worst of the worst because everybody else is getting out of jail. But people that are in jail definitely need to be there.
Thank you.
Further questions? Commissioner August.
As far as running space, have we looked into that?
We have, we put that out to several counties, and actually I know the captain just mentioned he just heard back from one county and wants to see what they're looking at. But we're not getting a whole lot of response to it. It's kind of surprising. We thought there's other places that we know are overcrowded, but they don't seem to be jumping at coming to us. But we did finally get one response, so he's looking into that.
Okay, thank you.
Just out of curiosity, the burden grant, is that one time annually?
No, I think it's just a one-time.
It seems like the burden grant's been around forever.
Yeah, and I don't know if it's something you can reapply for each year. I know it was difficult. Our captain had a heck of a time getting it approved, but he did the work and did get it done. Of course, with the way the federal budgets are going right now and everything, I think we've only received half of the money, but the other half is guaranteed for when everything gets settled. That was a one-time thing, so it's not going to sustain a lot, but it will get us a launching pad to get going.
Further questions, comments? Hearing none, we'll move to the prosecuting attorney's report.
I changed the first page of the report a little bit because we were having problems reporting on the victims' rights. So now we put the total victims for 2025 and then the new victims exercising rights. So your percentage of victims exercising rights is going to be for the entire year of 2025, but it does break it down because what we're doing is, you might have 100 new victims for the month of August, but you've got people who are signed up for rights since the beginning of the year who are still exercising those rights. So trying to come up with an accurate number wasn't working out. So this is the easiest way I've come up with. We've collected over 37,000 in merchant fees, jail reimbursements, just over 2,000.
Those year to date, those figures, the economic crimes figures?
I I thought the economic crimes figures were just for the month.
Okay.
So, yep, I'm pretty sure those are just,
Sure.
any questions?
Questions of the prosecutor?
Yeah, let me,
Mr. Van Dorn?
gotta find it if I can find, I was looking up this earlier, so, hold on. Be with you in a minute here. So when I'm looking at the report for Economic Crimes and Diversion Unit,
Yes.
and I'm looking at the total amount that has been received here, 1,100,000, or, yeah, 1,184,000. What's, is that the time period since the programs existed? What is the time frame for that?
So the first, which number are you looking at?
I'm looking at the report for, with the little, no, the one that has the graph on it with the pie shape pie.
Yes.
Yeah, okay, so if you, it says total general fund total or overall total recovered, 1,184,000. What's the time period for that?
Since 2014.
Okay, so it goes back to when it was started.
Correct.
Okay, the total.
Yep. So the year to date would be the 81,000.
Okay. Gotcha. Thank you.
Welcome.
Further questions, comments? Thank you. Hearing none, we will move to the public defender's report.
We submitted our report. It's pretty typical, nothing new going on in our office and, I answer any questions. Yeah.
Questions, comments? Hearing none, we will move to emergency management.
So I'll just highlight one thing. We're having our EOC workshop next Tuesday. We will be doing another one after the first year because there are some people in this meeting and in administration that won't be able to be there next week because of the
Meetings.
Ways and Means. When I set this up back in August, I looked at the commissioner's schedule and tried to pick a date where there were no conflicts, and then the meetings got moved. But because we want to have backups in each position as well, we had always planned on doing another one after the first of the year. So I'll make sure we get that on a date that doesn't conflict. Other than that, I'll answer any questions.
Questions for emergency management? Good, thank you. Hearing none. Doctor, you're on. Medical examiner's report?
For the month of September, we've had a total of 224 deaths that we've evaluated. 63 of them we've performed autopsies on. We're projecting that by the end of the year, we're going to have probably about 300 cases that we're going to review, which will be less than what it was last year. And our projected number of autopsies is going to be between 84 and 90. That'll come out to be 28% of the cases that we investigate. For the month of September, we had 22 deaths that we investigated. 46% of them were natural. 27% were accidental. Of those, 23% were under the age of 50, and the rest were over the age of 60. 77% were greater than 60%, age of 60, 50% greater than the age of 70, and 23% greater than the age of 80. Of those investigated, 64% were deaths that occurred in the home, and then the rest, 36%, were in a healthcare facility. And to date, of all the deaths that we have investigated, 17% were related to trauma. Our office has been continued. Sarah and some of our field investigators have been very much involved with career fairs We are currently having emergency medicine residents from Henry Ford Jackson rotate through the office. And we are currently working on the year-end summary to report the entire statistics for the month or for the year 24 for you. And the office, it continues to be involved with each of the county's child death review teams and opiate fatality review committees also that are mandated by the state. Currently, we're trying to recruit a third forensic pathologist to make sure that we have services that are uninterrupted and to help relieve the schedules of the forensic pathologists that are currently working for us.
Questions of the doctor? Commissioner Rungst.
Dr. Mano, I know you're probably not aware of some of the financials that we're investing in this, but can you enlighten me on the positions that have been added?
Oh,
there?
well, the two positions, one has been a lead, well, first of all, let me just preface this, is that we've been working and functioning as a regional medical examiner office for both Jackson, Lenawee, and Hillsdale. Currently in that office, Sarah and Tim Black and Alan take care of everything that occurs in the morgue. That means ordering supplies, scheduling the pathology assistant, scheduling the medical examiner field investigators. And what that does is takes them away from the other clerical stuff that we have to do. And then on top of it, many of the physicians, family physicians, you can see that by the number of autopsies that we do. Those are the ones that are true medical examiner cases. The rest of them are not, but many of the physicians in all the communities are refusing to fill out death certificates. So what that ends up happening is that we have to spend extra work obtaining all those records from the hospital because we don't know those patients, and then determining the cause of death because we try and minimize the amount of money that we're spending on autopsies and investigations because that's our biggest expense there. So the two positions that have been actually approved narrowly by the Board of Commissioners in Jackson and now being discussed with the rest of the counties is a lead medical examiner field investigator. That person will oversee scheduling all the medical examiner field investigators that go out to the scene, will review their medical records or their record to make sure that we're maintaining quality that can be used in court because those are foiable. We don't want to create any liabilities for the county by how we write them, but will also fill in and serve as a field investigator and will continue to do that. The part-time medical examiner or a pathology assistant, that person is going to be helping to, clean, maintain the morgue, order all the supplies for the pathologist, call the pathologist and notify them when we have cases, schedule the other pathology assistants, okay? That will free up Sarah and Tim then to do the rest of the work that we have to do because we have now committees that we have to be involved on for the state. So the work is becoming more and more. We have to answer lawyers and other information and provide medical records or records from our office. We do not release any hospital or physician medical records, just what we generate in our office. So that's what we're doing, and that's why those positions were requested.
Thank you.
Questions? Mr. Van Dorn.
I know we have some questions, especially with the amount that your rates have increased and what's happened here. So are those positions have been filled?
No.
with, oh, they haven't done. Okay. You're waiting for authorization from the other two counties?
We're waiting for everyone to, to agree, on that. We're looking at, as for the costs, I'm not involved in what, the rent that between the counties, agree to, and how that's determined. What I'm, involved in is the rates, that are charged by, the forensic pathologists, okay? And for years, Jackson County and then now, Lenawee and Hillsdale that had jumped, we've actually gotten a deal on the cost for the autopsies. The bundled price going, around the state for an autopsy, the pathology assistant, the x-rays, the toxicology, that are involved in x-rays, on an investigation is, the go around is 26, is 26,000 or $2,600 per case. That is the average, or the going price across the state. When I figured it out with our increase at the pathologists have increased that over the next year, the price going up to $1,800 per autopsy alone. And then all the other things which we itemize, our bundle price is going to be about $2,400. So I try and negotiate the best price that we can for the counties.
Well, it was a pretty healthy increase, so we're looking into it in depth, so.
And if you have any questions, you can ask our office, and between Sarah and myself, because I keep providing, I've contacted a number of the pathologists and medical examiners across the state to get their information and then provide it to the administrators.
Okay.
As I get it, so that they can distribute it to you.
Mr. Rungst,
A follow-up question to what you just discussed about the pathology cost. You're mentioning it going up to 1,800. I think that was in 2 years, wasn't it?
Yes, I believe it is. I would have to look at their letter again.
That's what I recall seeing. But then you're talking about a bundle, so really then that's not.
Well, what ends up happening is right now, most of the medical examiners' offices across the state bundle all of that together. So what I did was figured out on our itemized. Right now, we have an itemized. The actual increase is only going to be up to $1,800. I just bundled it to compare with the rest of the state when we go to the $1,800 per case.
Okay, I think where you confused me a little bit though is when you said 1,800 and it would put us at about 2,400.
The 2,400. What ends up happening is that with most investigations, okay, we perform an autopsy, we perform toxicology on them, we perform x-rays on them, and then we have to have a diener or pathology assistant come in and assist the pathologist. So what we've done is we charge all those and pay those all right now separately, okay? But they've been constant. And what we do is I bundled that so that we come up with a bundled price that compares with the bundles that the rest of to compare to the rest of the medical examiners. But the only increase has been in the calculation for the rent for that Jackson has made for the morgue, and then the increase rate for the cost of the autopsy.
Thank you.
further questions? Doctor, when you listed trauma-related deaths, does trauma include substance abuse death?
No, that is a separate category of its own. Traumas are, falls, like downstairs, and car accidents are the most common. And that's what we consider.
Any questions, comments? Thank you, Doctor. Hearing none, do we have any information from the courts? Okay, now we'll move to Marie Spear campus.
Unfortunately, Director Weaver is unavailable to be here. They are actually very busy right now, getting situated in the expansion because all youth have been moved from existing detention into the expansion. And demo has actually already started in old detention. Some of the big news from Marie Spear campus is the Girls Open Unit. They were able to walk in the End Alzheimer's participation for ProMedica Hickman Hospital last Sunday. The boys wing was able to be in a parade over the weekend, and they've all been helpful moving things into the new expansion, which has been great. In detention, they are working on personal psychology and adding a new book for their book club. And Nurse Williams was able to do a training of the new AED defibrillator in the expansion. And I think that's about all we have at Marie Spear campus.
Questions for MSC? Mr. Krasny?
Thank you, Shannon, for a great update. What a terrific event that was that the county and Marie Spears campus organized for the ribbon cutting. Such a huge local turnout of so many people. I couldn't believe how many people were there to see the great improvements and investments that the county is putting over there. And it just shows the impact for our greater community, for the central kitchen, et cetera. So just want to compliment you all on what a great event.
Having looked at the facility, the new facility, I'm gonna wonder how they're gonna have a problem getting kids going back into the other unit when it reopens.
Yeah. Right.
Okay, very good. Are there any other updates or business for this committee? Any other updates or business for this committee? Hearing none, is there any public comment? Any public comment? Hearing none, I'll entertain a motion to adjourn.
Motion to adjourn. Support.
Support, is there any discussion? Hearing none, those in favor say aye.
Aye.
Those same sign, motion carries. We are